Laurie is an occupational therapist and supervisor at neuro rehab program at Aurora West Allis Medical Center in West Allis. She's a certified driving rehabilitation specialist for adaptive driving. She's going to talk about driving safety with Parkinson's. Welcome, Laurie.
Hello, everybody. I'm happy to be here. As he introduced me, I am an occupational therapist, but I also am a licensed driving instructor in Wisconsin. And it's been kind of a journey to get myself to this point. And I'll share a little bit with you, about how that process worked for me. But I was asked to talk about balancing driving safety with independence for those with Parkinson's. And that's what we'll talk about today. So my objectives for you all would be that you understand the warning signs of changes in physical or mental performance that can affect driving ability, that you would be able to discuss current interventions available which aim to evaluate and improve driving behavior or identify when driving retirement is the best option. And lastly, to identify healthcare professionals who may assist in assessing fitness to drive. One of the hardest things to understand for adults is that driving is really a privilege. It is not a right, even though it feels that way. When we drive, we have made an agreement with the state of Wisconsin and all the other drivers that we are safe to be doing so. When you obtain your driver's license, it's really based on the skills that you show the instructor at that time. So, if you're going to drive, you really owe it to the other roadway users and yourself to make sure that you're safe. So, as we all know, it's extremely important to be able to drive. It's a mode for independence, not being stuck in the house, can go do your own errands. You don't have to rely on other people to take you places. Many people over the course of their lives associate their identity with that ability to be able to drive, especially those who've driven professionally over the years. And in reality, there's actually many studies that's been done that show that stopping driving can actually be harmful to someone's health. And it makes sense because it can lead to depression, it can lead to isolation, difficulty, getting medications and food and, even the basics. So it's not something that we want to take lightly as a therapist and a driving instructor, if we're sharing with somebody that maybe driving retirement is the best way to go. All right. So there are many things that can impair driving ability. So regarding, acute events, could be things that you hear, from your friends. Somebody had a heart attack, somebody had a stroke, somebody's, had dizziness or has passed out. Seizures is a definite issue. A recent surgery, even if it seems unrelated to anything to do with driving, it can affect your driving ability. And certainly delirium. And delirium is defined as something that causes you to be temporarily having cognitive impairments or temporarily confused, but it's something that's reversible. So we often will see delirium in patients in the hospital because they just get out of their routine. Maybe they're taking medications for the first time. And, they're not themselves while they're there. And that doesn't mean that they can't drive later, but it means that somebody should be checking on them. Chronic medical conditions that can impact driving function are also things that people talk about all the time. Vision issues, cataracts, all the visual diagnoses that can affect what you see. Heart disease, many older people take medication for blood pressure, or they're taking something, a blood thinner, or they have an irregular heartbeat. The people that we see here at the hospital are those with neurologic problems, whether it be dementia, MS, Parkinson's, stroke, peripheral neuropathies that make it hard to feel your feet and feel where the pedals are. People who have a lot of anxiety or mood disorders or problems with alcohol can also have issues with their driving. Diabetes can cause issues with driving through blood sugars that are either too high or too low. And diabetes is a main cause of that peripheral neuropathy that changes how the feeling in your feet go. And diabetes can also affect your vision. Chronic renal failure is another problem. And respiratory disease, COPD, is also another thing to be aware of. So there's many medications that can affect driving, and I'm not going to go into the specifics of these. My goal when I'm taking out a driver is that the person understands the basics of the medications that they're taking and why they're taking them. Ideally, I would like the driver to be managing their medications on their own, but also knowing that sometimes it can be very confusing if there's new things to watch for. So these are just a few of the things, that can potentially affect driving. So Parkinson's specific impairments that we see that we might be concerned about would be that processing speed. How quickly do you take in the environment and make a decision? And then that response time to what's going on around you. And it might be moving the foot from the gas to the brake. It might be turning. It might be, looking at what somebody else is doing and preparing yourself to be a defensive driver. So the key is looking for those warning signs for problematic driving. And this is where family members come in, friends come in, spouses come in. Is your person having difficulty turning to see when backing up? Nowadays, many people have, cars with that backup camera on them. And, people like to use that, but you still technically are supposed to be able to turn to see what you're doing when you're going backwards. Same thing goes for mirrors. Using mirrors is very important, but you're also supposed to turn your head to check your blind spot. That's, oftentimes older drivers or more experienced drivers stop doing that. And it's very important if you have any kind of visual problem. Riding the brake, so maybe people are driving two-footed, they've got left foot on the brake, right foot on the gas, and it's causing problems. You're seeing, other drivers are honking their horn or acting aggressive, by passing and things like that. Oftentimes we'll see situations where a spouse is a co-pilot. And when I say co-pilot, I mean that they're kind of directing the person who's driving. So the driver becomes now the operator of the car, but they're not making the decisions. And that's a big problem because obviously, things can go wrong and then there is going to be a delay between that decision-making and what happens with the car. Bad judgment when taking left turns. That is oftentimes the most dangerous situation when driving. People are in the middle of an intersection and they're trying to judge the gap and when they should go. And there's a lot of accidents that happen in those situations. Driving at inappropriate speeds. Generally, when somebody has Parkinson's or when somebody's older, the issue is not that somebody's driving too fast, but that they may be driving too slow. And there's certainly nothing wrong with taking your time. And that's a benefit when you're retired for sure. But if you're going too slow, you're going to cause other drivers to do things that are not safe. So it's very important to stay within at least 5 miles of the speed limit so that you aren't going to affect the other drivers. Other warning signs would be delayed response to an unexpected situation. A delayed response to a deer coming through or a bike or, a child coming into the road. And then finally, not anticipating a potentially dangerous situation ahead of time. So one option, if you or your loved one are noticing some of these problems, is to look into driving rehabilitation. So the first thing that you can do is make sure that you're getting the proper medical care. If you haven't been to the doctor for your annual checkup, do so. Make sure everything physically is okay for you to operate the vehicle. Make sure you're taking your medications correctly and at the right times, and that you're keeping up with it, and that you're not forgetting to take doses. You want to make sure that you're getting the proper physical and mental activity. Sitting in the recliner all day staring at a TV is not keeping you sharp for driving. And then once you've addressed the top three, certainly reaching out and looking into therapy is something that can help you make sure that you're being safe for driving, whether it be PT, OT, or speech therapy, or all three. So oftentimes, if you have gone to therapy, you've either had a therapist refer you to a clinical driving evaluation, or maybe you've been referred directly to a clinical driving evaluation. And these are tests that are performed by a specially trained OT in a therapy clinic. You need to get an order from your doctor for that, and it should be covered by insurance. The doctor's order should say occupational therapy, evaluate and treat. And it can also mention, for driving safety. And that clinical driving eval focuses on all the things that are related to driving safely. Your physical abilities, your vision, your memory, your attention, reaction time, and basic driving knowledge. So there are some specifics to the state of Wisconsin that you have to meet in order to even be eligible to drive. So the key to this is, once again, staying up on your medical appointments. The visual acuity for an unrestricted license is at least 20/40 in the better eye. If you do not meet that requirement, you may be passed to drive with some restrictions, but it's key that you're finding out from the eye doctor if they feel that you meet the requirement. If a driver comes to me for testing and they don't meet the visual requirement, there's nothing that I can do to help them unless they're able to meet that. Next would be the horizontal fields, or what people call peripheral vision. You're supposed to have 70 degrees in both eyes, or a 20-degree field of vision from the center in at least one eye. So what that means is you can drive if you have only one eye available to you, or perhaps you have one eye that's a lazy eye, as people like to call it, and the other one works well. That's okay, but you still need to meet that minimum for your vision. There are seizure-specific laws, and in the state of Wisconsin, you need to be seizure-free for 90 days in order to be able to be safe to drive. In Wisconsin, they do not allow bioptics. Basically, what that is a special magnifier that goes on your glasses that helps people that have very low vision. So we are not allowed to drive with that in Wisconsin. And then potential restrictions that can be allowed for driving would be driving during the day only, driving a certain radius from your home, maybe 5 or 10 miles. And then there's a whole slew of adaptive equipment that people can use if necessary that can be listed on your license as a restriction. So once the clinical evaluation is done, based on your scoring, you may be referred to do behind the wheel training. And because I'm a certified driving rehab specialist, I am also a member of ADID, the Association for Driver Rehab Specialists, and they actually have a best practice document that defines what these evaluations should be and what should be in them. And that is what I follow. So obviously we're setting goals based on functional abilities. If somebody has difficulty staying awake, I'm not going to set a goal for them to drive 7 hours by themselves up north. Common sense. We should be providing training in a variety of conditions and environments. We should ensure that the client can access aid in an emergency situation. If you get lost, do you have a phone? Do you know how to ask for help? We should provide education about funding sources for driver evaluation, training, or equipment, all of which I do. We assess vehicle transfers. If somebody isn't able to stand and walk, how are we going to get them in and out of the car? We also help with determining the best vehicle modifications and adaptive equipment. And we provide resources and information to assist with adaptive equipment installation. We also advise on licensing requirements. When I say advise, it's important to understand that an occupational therapist does not have the ability to take a driver's license or give it. We provide information to the family, the driver, and the physician. So that being said, there's a whole spectrum of decision-making for driving and community mobility. And this picture kind of describes that to you. So there is a generalist. So a generalist would be defined as an occupational therapist who works with a population like Parkinson's, who has basic understanding of what somebody should be able to do to drive safely, but not necessarily the specific advanced training to do that, okay? The next level would be that driving rehab specialist, okay? This is usually the person with more advanced training, potentially somebody who's able to take somebody on the road for a road test, licensed driving instructor as well. So when we're looking at these evaluations as a generalist in the clinic, we have to decide based on how somebody scores what our recommendation is going to be. So if I have somebody do the clinical evaluation and they score great, they score 100% on everything, no issues at all, then maybe they don't need a road test. And that's my recommendation, okay? If I have somebody who's kind of in that middle range, who, did well on some things, but other things were difficult, maybe the memory was hard, or maybe the reaction time was a little slower than what we'd like. Those are the people we're going to refer to the driving rehab specialist so that they can do a road test. And then finally, the patient who comes to see me in the clinic that isn't able to complete any of the tests well. Maybe they have some pretty severe cognitive issues or dementia to the point to where it's not even safe to consider a road test at this time. And that would be someone that the generalist could recommend that maybe they start planning for driving retirement. So options for road testing. Certainly you can test on the road with a driving rehabilitation specialist. At this time in the state of Wisconsin, there are 2 people who are certified as driving rehab specialists. I am one of them, and there is another gentleman that works at the VA hospital in Milwaukee, and that is it. And right now, the only private company that's doing the driving road tests is called Adaptive Driving LLC, which is a company that I co-own with my husband. So, there's very, very limited options in Wisconsin to get this done. My husband and I are qualified to give low-tech adaptation recommendations and provide evaluations to get those things installed. We do not do high-tech, which we'll talk about later. So that's one option. Another option is to go to a local driving school. And this is certainly a valid option, especially depending on where you live in the state. If you live, several hours up north from Milwaukee, it may be prohibitive to think that you could either pay the travel fee to have, a driving rehab specialist come to you, or for you to get down to Milwaukee. So maybe going to the local driving school and asking them if they have anybody qualified to take out an adult and an adult with Parkinson's potentially, and just do a basic road test and see how they're doing. And then finally, the obvious option for road testing would be the Department of Motor Vehicles. And we'll talk a little bit about what process has to happen before somebody can test at the DMV. So part of what the OT would want to do when they're making recommendations is help you understand what goes along with the different levels of road testing options. So a road test with a driving rehab specialist or somebody like myself What that means is you're getting somebody testing you that understands the medical and visual conditions and how they relate to driving, works with your doctor to determine the best plan for you. I can come to somebody's home and provide testing where they live, especially for people who do have some mild memory problems. Sometimes that's extremely helpful. I am able to help you decide on any adaptive equipment that would help you drive safer. However, the services that I'm able to provide are not covered by insurance. So there is a private fee for you to do a road test with a driving rehab specialist. So if you were looking to find a driving rehab specialist, a couple of different places you could go. The AIDED homepage, and that'll give you a listing of all the AIDED members in the United States and even some in Canada, I believe. And it kind of gives you information about who is doing what type of adaptations. And it can also allow you to search for people who've been certified versus are at the level of driving rehab specialists. The AOTA homepage has a productive aging and older driver center. So an OT can identify themselves on this directory, and I am on that directory as well. Also, you could call the local state medical advisory board that you would find through the DMV to help you. But as I said, at this time right now, there's only 2 of us. All right, so we talked about, the differences between the driving rehab specialist and a road test with a local driving school. There's pros and cons to both. Going with a local driving school is going to be less expensive, okay? And for some people, that isn't important because they just can't afford a road test and, have to, pay $250 to $350 for that. The local driving school is also in a position to do some driving training. So maybe you're in a situation where your family's worried about you driving, but there's nobody that can take you out practicing. So a local driving school could do that and be that other, licensed adult in the car to do some practicing. Or they can do a road test similar to that of the DMV that would provide information to your family. Typically, this person is not going to have any knowledge of medical conditions or Parkinson's specifically. And what I found for those with Parkinson's that have issues with tremors or soft speech or rigidity, this might be harder for this type of driving school instructor to deal with. So if you're going to road test at the DMV, you have to follow the reporting process. Typically, there's no charge to complete a skills test with the DMV, but what you have to do is provide the appropriate medical examination questionnaire that your doctor has filled out. From our experience and from experience of patients that we've had, oftentimes, depending on what DMV you call, you may get different information. Do I need to have a spinner knob listed on my license as a restriction? Sometimes they'll say yes, sometimes they'll say no. So it sometimes can be difficult to navigate. So getting in contact with an occupational therapist that has experience with driving can be helpful because we can help kind of lead you through this path. When you go to the DMV, if you test with them and you don't pass, your license will be suspended and potentially you would have to take the written test, the road signs test, and the road skills test over again. You can take these tests at the DMV for up to 5 total tries before they would revoke your license. So one question is about who can report somebody that potentially is an unsafe driver. And this lends itself to that process I told you about that has to be done in order to test at the DMV. So I'll go through all of the specifics with that. So who may report? Medical professionals, law enforcement, or private citizens. So as an occupational therapist, I have reported patients who were not safe based on our testing and our sessions for driving that verbalized that they had no intention to stop driving. Law enforcement would be, the police officer pulls you over because you're holding up traffic or because you made an inaccurate turn or some other problems, and then they may choose to report you to have you retested. And private citizens can report. So what that means is if your neighbor is impaired and potentially unsafe and you know that there's issues, you can fill out a report and have that sent to the DMV, and then they'll decide if that person should be retested. In the state of Wisconsin, there is no mandatory reporting for physicians. So what that means is your doctor, perhaps your Parkinson's doctor, is not required to report to the DMV that you have Parkinson's and that'll affect your driving. They're encouraged to report, but they do not have to. As far as self-reporting requirements, there's none listed specifically, but you may need to present that medical examination report from your doctor. Reportable conditions would be a loss of consciousness, a seizure, impaired cognition, so bad memory, dementia, shortness of breath, somebody who gets tired very easily, severely impaired reaction times, issues with medications, vision problems, and of course, use of alcohol or drugs. So if you're looking for the reports for the DMV, this is where that you can find them. And certainly you could go to the DMV Service Center, but you can also find some of that information online as well. The driver condition and behavior report is actually what a private citizen would use to report somebody that they're worried about. And that it's basically an open page for you to write a couple paragraphs about what you've noticed and why that person is potentially unsafe.
Thank you so much, Laurie. Great job covering a topic that I think a lot of people have questions of, something a lot of. We have a few questions that have been submitted. If you have more questions, please submit them in the chat. But a couple of the questions that came up, you mentioned, Laurie, if somebody has a seizure, they have to wait 90 days for reevaluation and things like that. One of the questions was, does that include like tremor and dyskinesia and Parkinson's disease? And how do those fit into maybe that seizure concerns?
Okay, good question. A seizure would be diagnosed as a seizure. So that would be something that shows in your medical record that the physician has called a seizure. So tremors and any of those things that go along with Parkinson's would not qualify. That would be something different.
Thank you. One of the other questions was, you talked about a spinner knob, and the individual posted and said, what is a spinner knob? Can you maybe describe that a little bit so people understand if people are familiar with the terminology?
Sure. A spinner knob is the same thing that, back in the 50s and 60s, people used to call them suicide knobs. Before there was that electric steering and the wheel was really hard to turn, they would help people turn the wheel faster. So we can help people obtain a spinner knob if perhaps they only are able to turn the wheel with one hand, or if they're going to use hand controls to drive. So it's just another example of a low-tech adaptation for them. Okay.
A question that just came in, can the DMV disclose who reported them?
Ironic that came up because they do. So my father is 85 and he was having some driving issues. So he and I discussed it, and he knew that I was reporting him to the DMV. But when he got the paperwork from them, it did say that I was the reporter. So that if you don't want to be disclosed as the reporter, you should contact the DMV and make sure that that information is not going to be given, or, confirm that that information would be given to the individual.
So if the DMV...
So I would say yes, they're probably going to disclose who reported the person.
So with that information, Laurie, I think it really highlights something you touched on a little bit. the importance of communication then. And if I'm a loved one whose father has Parkinson's disease, do you have any tips or discussion as to things maybe I can do to start that discussion with him to see if his driving should be halted at this time?
Okay. The key for me and everybody I take on the road is awareness of deficits. So, nobody is perfect, and no adult, is ever able to drive without ever making a mistake, but you have to know what you're not good at. So if you talk to your loved one and you're talking about reaction time, and you have a conversation about, have you ever had, trouble, stopping on time or things like that, and they have no idea what you're talking about, or maybe they get angry and defensive, that can be a red flag. If you are in the car with them and they make a mistake and you discuss it, and they're highly defensive or don't remember, that's a red flag. Many families will ask an OT or a driving rehab specialist to test their loved one because they need a impartial third party to help with some of that decision making. And, as you can imagine, the reason I sent my dad to the DMV is because he wasn't going to listen to me taking him out and giving him driving recommendations. I needed a third party to do that. And, as a driving rehab specialist, I am happy to be that third party and be the bad guy if it'll help people be safe.
And then the last question I have, and it actually came up here, is there a mandatory age in Wisconsin that people need to be retested? I got my license when I'm 16. Do I not have to ever get retested the rest of my life, or is there an age that I need to go back and get retested and reexamined?
Okay. In the state of Wisconsin, there is not a mandatory age. And that's good and bad, because from, my experience, the age isn't really the issue. The medical abilities and, wellness is a bigger issue. I can have somebody who's 50 and has multiple medical problems and issues that affect driving, and then take out another gentleman who's 90, who's, incredibly sharp and has no issues. So I don't necessarily think people should be tested based on age. But certainly, when there's medical conditions in addition, I think it has to be looked at. But state of Wisconsin does not do that.
Well, those are the questions we have. I want to give you a chance, Laurie. Can you give us the information how to contact Adaptive Driving if we want to set up an exam?
Yes, absolutely. So you can call directly to 414-721-8636. Or you can find us online at adaptivedriving.com or adaptivedrivingllc.com as well.
Great. I hope a lot of people use that resource. Really appreciate your time, Laurie. I'm sure if you really listen closely, people are applauding and cheering and saying thank you. So